Sure. Best part is the people who get on before, they start
Yeah.
messaging back and forth.
Are we gonna be on time as far as you know, or?
Oh, I don't know.
I think so.
Oh, okay. Cool.
He's here and everything.
Okay.
Make sure it works.
Chance, how we doing?
How you doing?
All right. Everybody, how are you?
You give me enough room? What did I give you?
Oh, yeah, yeah. Chair, I think.
Good morning. This morning, employees of our Parks Department installed pride flags in Memorial Plaza, just to the right of where I'm standing. Displaying the flags has become a tradition of St. Louis County, one that I'm proud of. When our LGBTQ employees see the flags, I want them to know that we support them and we welcome them. And when our residents come to Clayton to do business, I want them to know that we see them, support them, and welcome them too. We want it to be clear that St. Louis County is a welcoming place to work, live, and enjoy. We live in an environment where so many of our residents are under attack for being who they are. In March, I signed a bill that adds gender expression to anti-discrimination protections for St. Louis County workers, including contractors and non-civil service employees. The bill, sponsored by Councilwoman Lisa Clancy, ensures St. Louis County is a welcoming and inclusive place to work. It's important we stop once in a while to make it clear where we stand and why we do what we do. Missouri remains a state where it is still legal to discriminate against someone who is gay or transgender. And that means a person can be fired, denied housing, or kicked out of a restaurant for being gay or transgender or simply being perceived as gay or transgender. Since 1998, advocates for LGBTQ rights have tried to get the Missouri Non-Discrimination Act passed in Jefferson City. MONA, as it's commonly called, would add sexual orientation and gender identity to Missouri's Human Rights Act, which currently prohibits discrimination in employment, housing, and public accommodations for other protected categories, including race, sex, and national origin. When I was in the state legislature, I supported a version of the MONA bill that, like others, got sidelined by misinformation, ignorance, and indifference. Fortunately, many of our employers include sexual orientation and gender identity in their anti-discrimination policies. But a statewide law would provide clarity and peace of mind to those who can still be discriminated against. We must keep these conversations in the forefront. Across the country, we are seeing gay and trans kids under attack. The infamous Don't Say Gay bill in Florida, the battles over which bathrooms kids should use, the debates over what should be taught to our children because it could have a gay character or a storyline that shows people of color have been historically treated differently. Why would we not want the best for everyone? It's a question I cannot get a good answer to from those who support legislation that continues to divide us, creating us versus them categories. We're seeing it with reproductive rights, Roe v. Wade in jeopardy, meaning the health of women is in jeopardy, and that's why we have committed to expanding reproductive health services in our Department of Public Health clinics. We cannot stand by letting lives be endangered. Public health departments are safety nets, ensuring those who are uninsured or underinsured have access to health care services. Reproductive and sexual health services are a critical piece of a health department's mission, and some of the services provided include family planning counseling and options like information about nutrition services, annual exams, and screenings for predominantly female cancers. The services related to pregnancy and childbirth are integrated into primary care services. Testing and treatment for sexually transmitted infections are also an important role for the health department. The Department of Public Health's nursing program includes visits to pregnant and postpartum patients and their infants. The program focuses on healthy pregnancy, labor and delivery, infant feeding, and overall health and wellness of the parent and the infant. Our commitment is to ensure that reproductive and sexual health services not only continue but are expanded in St. Louis County, and that includes conversations about and access to many forms of safe and effective contraception. Many residents of our community and our country are anxious. The erosion of freedom, the bedrock of this community, is happening at an alarming rate. As long as we stand united, we can beat back ignorance, hate, and the constant push to divide us. As we officially kick off Pride Month, let's stand with our trans kids, our gay colleagues and family members, our children who are trying to navigate what could be a very complicated world. This isn't grooming, folks. This is loving and caring. This is standing up to bullies, elevating your voice, writing your congressperson, and having a conversation rooted in compassion. In Missouri, it's still okay to say gay. Let's make sure that does not change. Thank you, and I would be happy to take any questions. I think that
Are there any, I guess, further legislative proposals that your administration is considering regarding things like updates to the charter or any other policies that would help to make the county more inclusive for LGBTQ folks?
We don't currently have any policy proposals for the LGBTQ community in St. Louis County. We've done a great deal in the past 3 years trying to stay at the forefront of anti-discrimination policies, making our county more welcome. We're certainly willing to listen to anyone who can show us a way that we could be more inclusive, but we've worked really hard to stay in front of that and to take every opportunity we can to make people feel included in St. Louis County.
I have questions about some other topics.
Okay.
One of them being there's a bill right now for the council to extend paid parental leave to 12 weeks. Do you have any thoughts on that proposal at this time?
Yeah, so the question is about paid parental leave for county employees, and I expect us to expand that policy. We're looking at it now. We're listening to everyone who has input, folks that understand that this is good public policy, that there are some expenses associated with it. I think we'll work through that, and we'll get a bill that everyone can agree with.
I also wanted to ask about the jail, if you could respond to the departure last week of advisory board member expressing frustration about, while noting improvements at the facility, expressed frustration about the audit that's ongoing now.
So there's a question about what's happening in the jail, and when we first took office, when my administration took office 3 years ago, we instituted an enormous amount of reforms. A long list of accomplishments have been recognized by the critics and the supporters of our policies. We're now treating folks in the jail with dignity and respect, and with an opportunity to improve their lives and get back on track. There are educational programs and learning opportunities while they're still in jail. A long list of fees have been erased. We've done quite a bit to improve the communication between correctional officers and our nursing staff. We provided more training for our nursing staff and correctional officers. I think if you talk to the correctional officers, they will recognize that it's a much better atmosphere than it used to be. We were able to secure pay raise for the correctional officers, which reversed the trend in officers resigning and looking for work elsewhere. Some of those have come back, and we're now nearly fully staffed. So there are a lot of great things happening in the jail. There are opportunities for improvement, sure. One of the reasons why I appointed some of our critics to the advisory board was to hear their concerns and to make sure they held us accountable. We can't always do everything everyone asks, but their opinions are very important to us, and they need to be incorporated with the opinions of everyone else on the advisory council so we can find the best path forward. The improvements in the jail are there because we've embraced the concerns of our critics, and we'll continue to listen to what they have to say. The outside audit that's currently ongoing is unprecedented, and there will always be room for improvement. We'll listen to what they have to say. We'll incorporate those recommendations into the practices at the jail, and we'll go back and revisit it in a year or two to make sure that there's continuous quality improvement there. We're very proud of the changes in the jail in St. Louis County. It's one of the best jails in the state. It's one of the best jails in the country.
And do you provide an update on the audit, when it's expected to be completed, and what we can expect to see from it?
So the question is about the audit of the jail and what we can expect to see. I would expect that they will tell us that we've done a lot of really good things over the past 2 years that should be recognized nationally. And when those recommendations come, we'll listen to them. I expect they'll also show us some opportunities for improvement. And that's why we asked them to come. We knew we were doing better, but we know there's always opportunities to do better, and how we treat folks in the jail is important to us. When that process is done, I don't know. I have to ask the staff how that's going and what the timeline is for a report.
At this time, do you have any plans to replace the 2 vacant seats on the board?
Oh, we've always got people. So the question is about the vacancies on the Justice Service Advisory Board, which was not meeting on a regular basis until I took office and hadn't met for years. And we've put that board to work. We filled it out, and we'll talk to folks that are interested, and we'll make sure that people on that Justice Service Advisory Board bring something to the conversation of improving the lives of folks that are in jail and making sure that they're on a pathway to a job and a career and not a pathway to reoffend.
Anything else? Thanks, everybody.
Okay, thank you.